Good morning, colleagues. I'm Sung-Yong Cho
Ho-Young Ryu.
In the Boraman Medical Center, Seoul, Korea. Our article investigated the Dietary factor for urinary stones in Korean population. Relationship between Dietary factors and the incidence of urinary stone have been reported in previous articles, but the data of Korean population is lacking until now. So we investigated the relationship between urolithiasis and Dietary risk factors in Korea through a prospective case control pilot study.
First of all, we'd like to talk about the method of analyzing the food ingredient used for the Dietary study. Now, this table is the food frequency questionnaire. The questionnaire was used to investigate the type and amount of food intake, and then the food photo for quantity estimation to find out what nutrients were included in each meal. Dietary used the program called CAMPRO, in which the information of the frequency and daily intake of food was included. We can find out the type and frequency of eating individual nutrients in each meal. Gender, age, BMI, physical activity level, and total calorie intake were investigated for both patient and control group. We included the dietary factors such as total energy amount, carbohydrate, lipid, protein, vitamin C and D, fiber, folate, calcium, sodium, magnesium, and water intake volume. So we compared dietary factors between patients and control group.
Table 1 shows that the patient group was older than the control group, and the patient group had lower levels of physical activity than the control group. In Table 3, patients were more likely to have vitamin C, calcium, sodium, magnesium, water intake, total energy intake, carbohydrate, lipid, animal protein, and vitamin D than the control group, but the results were not statistically significant. At Table 4, the risk of nutrients and stone formation increased with increasing amount of carbohydrate and protein intake accordingly. Table 5 shows the differences of mean and daily intake volumes of food groups between the two groups. There were no significant differences between the two groups in terms of intake of various foods. Table 6 shows the effect of each food intake on the urinary stone formation. Intake of cereals increase the risk of stone formation. As above mentioned, we observed the association between cereal intake and the risk of urinary stone formation. Cereals and cereal products can contribute to the considerable amount of oxalate intake.
Dietary oxalate contributes up to 50% of urinary oxalate excretion. The amount of oxalate excreted in urine makes a marked contribution to calcium oxalate supersaturation, and as a result is an essential factor in the development of urolithiasis.
In conclusion, this study investigated the risk factors that lead to stone formation and their relationship to dietary habits in Korean population. So more intakes of carbohydrate, protein, and cereal products can increase the risk of urinary stone formation. So a large-scale multi-center prospective study is necessary to establish the dietary risk factors of urolithiasis. Thank you.